The pathology that I chose to research was chronic fatigue syndrome. Right now, there is no known single cause of chronic fatigue syndrome. There's many different theories out there, though. Some believe it's caused by a bunch of different disorders, while others think it's an immune disorder. Stress and the way one lives their life could be contributors to who develops chronic fatigue syndrome. Okay. It seems that people who suffer from chronic fatigue syndrome have weakened immune systems because there is a correlation of abnormal lymphocytes and people with chronic fatigue. It's pretty likely that this is the reason for the disorder. People with chronic fatigue syndrome have a lower T cell count, so it's reasonable to assume that people with this disorder have the weaker immune system than an average person. T cells seem to be the only cell affected by chronic fatigue syndrome. Side effects of chronic fatigue syndrome include depression and psychological and social dysfunction. There seems to be a higher correlation of depression in patients with chronic fatigue than with an average person. Many patients who suffer from chronic fatigue have an imbalance of serotonin and dopamine. Their serotonin is increased and their dopamine is decreased. It often resembles people who are suffering from an infection. Psychological and social dysfunction are also linked to chronic fatigue. Many people feel a lack of control in their lives. For example, they might lose their jobs or possessions or friends. This happens often with this disorder. Continuing with side effects, lack of sleep is obviously a huge side effect of chronic fatigue. Their sleep patterns become distorted and they get feelings of helplessness because they cannot achieve a restful night's sleep. People with this disease may also start to feel like they don't have any control in their lives because they're only focusing on the negative aspects of the disease. So there are many symptoms of chronic fatigue. Extreme fatigue, which means that people are tired for over 24 hours and they just cannot achieve a restful night's sleep. They have a hard time focusing, they have lack of concentration, and pain. They could be experiencing new headaches, sore throat, and pain in joints. It becomes harder to distinguish whether or not the person has chronic fatigue or has another issue because chronic fatigue is hard to diagnose because we don't know what causes it. Swollen lymph nodes and muscle pain are also symptoms. There are a variety of treatment options for people who become diagnosed with chronic fatigue. These include antidepressants, sleeping pills, graded exercise, and psychological counseling. The most successful form of treatment seems to be graded exercise and cognitive behavioral therapy. And graded exercise is an exercise regimen that starts slowly and over time becomes more intense. And cognitive behavioral therapy is a short-term goal-achieving form of therapy that works on problem solving. And what it does is it tries to change the way a person views a situation. Consequences do arise from chronic fatigue syndrome. Depression, mental fog, dizziness, and irritable ball are all short-term consequences. Long-term consequences that arise are poor self-esteem, loss of relationships, poor finances, and other illnesses like fibromyalgia. When someone is diagnosed with chronic fatigue, they may discover later in life they also have fibromyalgia. The two disorders go hand in hand usually. Um, People can achieve remission with chronic fatigue, but they can relapse by once they start feeling better. They might try to overexert themselves with exercise, and that can lead to a relapse along with poor diet and high amounts of stress. And that is chronic fatigue. Thank you for listening.